Hello, Dr. Brett Butterfield here. Today I want to talk to you a little bit about red wine. So red wine is part of our program, and I want to talk about why that is. And then also I have to mention that we have many patients who have a religious exception that they shouldn't drink red wine, and that's fine. I'm going to respect that, and there are some exceptions, or there's some substitutes, some things you can do instead of red wine if you have a religious exemption. Otherwise, you're not off the hook, because you're not going to get all the benefits from these substitutes. But you can do either a dark chocolate that's sugarcane sweetened, preferably high percentage dark chocolate, and then you can also do drink like a classic Coca-Cola that's in a glass bottle and uses sugar cane. So both of those are going to provide a challenge to your liver, and they're going to help upregulate your liver's detoxification enzymes. And that's one of the benefits we're trying to get out of red wine. Again, if you don't have a religious exemption, then you really should be integrating red wine into your diet on a daily basis. Of course, this is not for people who are at the beginning of our program during the phase called the sugar control phase, or phase 1. This is for phase 2 once we began adding in foods. And some of you may need a little bit of help. Not everyone can handle alcohol or red wine specifically, but that's a broken body. So we can do some things to help your body so that you can get the benefits of red wine without getting any negative effects. So I want to talk real quick about some of the benefits of red wine. Red wine is a caloric restriction mimetic. So there's a lot of benefits you get from calorie restriction. The intermittent fasting is very popular right now. I'm going to make another video talking specifically about caloric restriction, but just know that red wine actually mimics the benefits you get from caloric restriction. Next, there's been a study showing that red wine mimics the benefits of exercise, and they're even suggesting that people who can't exercise should be drinking red wine so they can get some of the benefits of exercise that way. Red wine in general is neuroprotective, so it helps out with Alzheimer's disease, Parkinson's, dementia. It's a caloric-friendly alcoholic beverage. It can lower the risk of heart disease and stroke, and then it also helps out with your mouth and gut microbiota. So there's a lot of benefits that we can get from red wine. I mentioned that it also strengthens the liver and detoxification pathways. We really want to be integrating this into your diet. So how often should you be doing it? You could have some every night. Half glass of red wine is totally fine. Just know that it can be dehydrating. It is dehydrating, so you need to drink water to make up for it. I'm not telling anyone to drink to excess, of course, but if you're drinking water, then you'll stay caught up with your red wine. It also helps to drink it with a meal, and as a general rule, red wine is typically drank with red meats. I am certainly not a sommelier or connoisseur of red wine. I've dabbled a little bit, and I've integrated it into my diet, so you don't have to know a lot about red wine to make it part of your diet. So how do you choose which red wine to get started? Because some people say, well, I don't like red wine. Well, there's quite a bit of variety in red wine, so you probably just haven't found one that you really like. And so there's a few things you can do about that. If you are wanting to get more educated, there's an app called The Greatest Courses, or Wondrium, I think they just changed their name to. In there they said that the Syrah red wine is a good starting one. So it's a good one for people who don't like red wine, they say. Most people, when they're starting off, they like sweeter wines, but really it's what you can do is you can go to your local health food grocery store, where at most of them they sell red wine, and they have someone there who does know a fair amount about red wine. They can help you choose a red wine that you like, and a lot of them, they'll even let you do some taste testing. or there's specific wine shops where they do a lot of taste testing. So there's a lot of resources in your local area that you can use to find a red wine that you like. Now, if you are going to be drinking wine on a regular basis, whether that's a couple times a week or every day a week, one issue that can be is if you get a bottle of red wine and you open it, that bottle of red wine is only going to last a couple days. You can try and stuff the cork back in, but it's going to get oxidized and it's going to go bad. And so that can be a little bit of trouble if you're trying to extend the life of that red wine. So you can get what's called a wine bottle stopper, which is usually like a rubber cork that you put in top, and then you can use a suction device to suck the air out of the wine bottle, and that'll preserve it for a few more days. Up to a week is typical. The other recommendation would be drinking boxed wine. And boxed wine it's in a plastic sort of bag, and it has inside of a box, and then it has a tap. And so you can just get wine on tap whenever you want, and that seems to last a long time. It's also very economical. Usually it's less expensive than bottled wine. And the brand that I've seen that seems to work the best is called Black Box. So Black Box wine, and you just find a wine that you like and you use that. So there's a lot of benefits to red wine. There's been an argument made that it's just as good to drink grape juice. That's totally not true. They're very different. You're going to get a lot of constituents drawn out of the grapes with alcohol that you would not get from just grape juice, from the water essentially. And so this is a requirement of the autonomic recovery program. So recovering the balance of your autonomic nervous system and restoring general health to your body, very important factor. And so start integrating red wine today if you haven't done so already. Thank you.